Well, good afternoon, everyone, and Happy New Year. Welcome to the McGill Dementia Education Program's Caring Conversation, which is another free community outreach initiative to provide virtual support to care partners of people living with dementia. I'm Claire Webster. I'm founder of the McGill University Dementia Education Program. And I just wanted to let everybody know about the comprehensive range of free resources that we have on our website. If you go to mcgill.ca/dementia, there's all kinds of webcasts. I've recorded over 80 McGill Cares webcasts that are also available on Spotify. We have virtual support groups called the Sharing Room, a great dementia activity booklet, and then we have this very important resource called the Dementia Companion Guide. It's available in 8 languages. You can download it for free off of our website. And many of the languages, you can also buy a printed copy on Amazon, and all proceeds go to our program. The book is only $20, and it really is a very comprehensive guide. So I encourage you to all please have a look at all the other resources that we offer. And most importantly, past episodes of Caring Conversations can be found at our website as well. So today we have a very important topic, which is called conflict among caregivers. First of all, I would like to thank the Petro-Canada Caremakers Foundation for supporting this initiative of ours. And the topic is what conflict among caregivers, what we can do when siblings, family members, and other care partners do not agree. So I would like to introduce your hosts, Lucy and Joanne. So Lucy Barylak is a social gerontology consultant for the CIUS West Central Montreal and a graduate of the McGill University School of Social Work, where she's also a liaison supervisor. She has developed evidence-based training for seniors and caregivers, and she lectures in the field of social gerontology and knowledge transfer. We also have Joanne Besner. She is an educator, professional coach, and caregiver. She received her Bachelor of Social Work and Master of Business Administration from McGill. She has a 35-year career in public community healthcare in Quebec, which spans many roles, including frontline case manager, clinical supervisor, manager, researcher, and trainer. So I invite you all to just please keep your microphones muted. There will be plenty of opportunity to ask questions. We encourage you to either during the question period, you don't have to show your visual if you don't want to. You can write a question in the chat. We're going to be monitoring the chat. And I just want to let everybody know that this episode will be recorded because we do like to have past episodes on our website. So I will let it over to Joanne and Lucy. Take it away.
So good afternoon, everybody, and thank you so much for joining us today. So the agenda today, we are going to look at why is there conflict in caring? What are the common concerns, conflict resolution strategies, and we're also going to talk about what happens when nothing really works. Next, please. Okay, there are all kinds of carers, families, carers that get along and those that do not get along. Other relatives as well. Blended families, step families, second marriages, out of town, long distance carers, absentee carers that are really not that involved, but still feel they are, carers by choice and not by choice. So there, the whole idea behind this is what is actually happening. So if you are not a sole caregiver as I was, and there are other family members involved in the caregiving, I have to tell you that it can be a blessing, and sometimes it could be a curse at the same time. Most families have conflict from time to time about different issues. It's normal. But if you add another layer of care to the situation, conflicts can escalate for many different reasons. Caregiving for a family member with loss of autonomy and dementia is already stressful and exhausting. Add-on family conflicts can be more devastating than the illness itself. So what is happening? Okay, there are a lot of feelings and emotions that you as a caregiver need to deal with, some of you, on a daily basis. Many times your life is focused on the person you are caring for and thinking less about your own needs. For example, their daily care, their appointments, finances, how to deal with difficult behaviors. And many times caregivers tell me it's just keeping your head above water. So each family member has their own morals and values that dictate their own needs and behavior towards what they believe is the right decision for the care receiver. There's definitely a lot of burden and responsibility when caring for a dependent family member. So if you are experiencing family conflicts, try to identify your relationship history with that person. Did you get along with them in the past? If yes, so what's happening? If not, are there still are they or are you still harboring negative resentment from the past that has never been resolved? One of the most important things to keep in mind and understand your own behavior as well as theirs and the reasons behind the conflict. What tools do you need to develop and practice in order to possibly resolve the conflict? So these are all of the things that we're going to be talking today, and Joanne will be discussing some of the real common issues that a lot of families experience with conflict. Joanne?
Thank you, Lucy. Yeah, so we've kind of narrowed down to share 4 big concerns with you today. And we're going to start with the first one is denial. Denial, different perceptions amongst the carers. You know, you can have the exact same situation seen completely differently by 2 people. When it comes to the impacts of dementia on the person we're caring for, what do we actually see? Do we see only what we want to see? Do we deny or do we dramatize? This can be explained by maybe how frequently you see the person, when, what time, but it's also impacted by our own level of education and knowledge about the disease and our own ability to accept. A big one is finances, money, whether it is plentiful or scarce. When money is scarce, let's face it, caring is extremely costly. At home, you're purchasing equipment, incontinence products, paying for home help. If money is short, who is going to supplement? And if there is none, who has to contribute their time? Someone may have to leave their job. This can be distressing amongst caregivers. When money is plentiful or stands to be inherited, there are still questions. How should it be used? Do we live now or save for later? And whose money is it anyway? Of course, the big dilemma that we discussed last month in our webinar, home versus nursing home, and the decisions that come along with that, as we discussed, that can really polarize carers. For example, we often see spouses who are absolutely exhausted, they're burnt out, and they're finally ready to relocate their partner to a nursing home, but the children are distressed, they just can't accept this, so there's disagreement. And finally, sharing the caring. The load is often uneven. Carers can sometimes feel taken advantage of. You know, there is no legal obligation to care for a relative with an illness except for a child, a minor. Everyone has a choice. And when some carers say no, that choice can be viewed as selfish, when that choice actually may be based on their survival. So, and I just wanted to add, these are just 4 issues, and I'm sure you're thinking about your situation, and we'll be anxious to hear about what kind of conflicts you're facing. So if you are pulling out your hair over the conflict that you're experiencing now, you may find yourself thinking, was there something I could have done to prevent this? And before I answer that question, I do just want to address the fact that not all conflict is bad. It's extremely important to not run from differences. Allow them. You know, conflict is a natural part of healthy relationships. Avoiding tough discussions can sometimes hold you back, add to family dysfunction, and cause you stress. And also, allowing these discussions sometimes enables you to get additional, better information together than you might not have had alone. So, can you possibly view conflict as a way to improve your results? That being said, there is healthy conflict and there is non-healthy conflict. There is absolutely no place for aggression, verbal abuse, even by text or email, violence, bullying, ostracism. Being withheld from your person, not being allowed to visit them without their permission, can signal a risk factor for elder abuse, particularly if you're not allowed to see them and ensure their well-being. That's a red flag. But there are certain things that we all can do, at least to minimize conflicts, and that comes with really preparing in advance. It's really important to discuss and share your wishes and options before there's a crisis. So family care units should share all the information about who has the mandates, who has the power of attorney, the living wills, all the financial and decision-making powers. So at least you know what you're going to be dealing with. Maybe you have some time to work on it in advance before the crisis. There will be enough surprises and enough of the unexpected. Plan for what you can. So now we've looked at conflict from a few different angles. So what do we do about it? So Lucy and I want to take you through a few approaches and tips. How do we handle conflict? So the first thing that we have to do somehow is always start with empathy. Put yourself in the other's shoes. Now, I know this is a big ask, especially with challenging family members, those who might have mental illness, personality disorders, or some are just plain difficult people. But it does help to find some way to empathize with their situation. So if you can, try and put yourself in their shoes and imagine what it's like to be them. And now, look at this lovely family. Do you recognize this family? I don't know if I have to give a hint, because we do see our late Queen and King Charles and the two brothers, Harry and Andrew. So imagine if the royal family had to caregive together. So the point of this slide is we all have a little bit of the royal family in our families. It's incredibly important to acknowledge your family dynamics. Who are you working with? What are their strengths? What are the allegiances? Where are the broken ties, the pain? What are the alliances? So once you address the dynamics in your family, you're more able to move forward. Communication. Of course, communication is the key. You need to be in touch, whether it's text, email, phone, Zoom, or in person. Find the best mode of communication for your family. But the thing is to share important information with everybody as much as you can at the same time. Do not leave people out. And share when things change. There's nothing more frustrating when one of the caregivers is working and has assumptions and the whole situation has changed and they're not aware of it. And finally, share your feelings. I know sometimes we feel like, well, the other carers, they should be respectful. They should know what I need. They should just do this for me. But avoid intuiting what you think they should do. Share your feelings. Say what you need. Say what you feel. So now I'm going to provide just a couple of models that I hope you'll follow along with me. And I'm going to say there's a bit of information in here. Do not worry about taking notes, because I understand these slides are posted on the website, so you can go back and refer to them after the presentation. So the first strategy, 2 truths, starts with validating the other person's perspective and priorities first before yours. And then once you've documented theirs and yours, then you move forward with a solution to both. So I'm going to tell you a bit how this can work. And I think we're gonna try to use the example of a spouse who wants to place their partner is ready, but the children are very, very distressed. So imagine you're getting together, and we're going to do 2 truths. And the first thing you're going to do is you're going to grab a big paper that looks, I hope you can see this, that looks like this, and you split the paper or down the middle, and you have truth number 1 and truth number 2. And if there is a third perspective, you just divide it into 3, and you put room for 3. So then let's say this wife has her kids together. She's going to start by first going to the kids and asking their perspective, asking them questions to understand what's beneath their position. What are their emotions? What are their fears? And acknowledge, let them know she's listening and hears their view. And then you write everything down in black and white on their view, and you label it truth number 1. So everybody can see that is truth number 1. And then you move on, let's say the wife, to her truth, and ask your children, as I listen to you, please listen to me, ask me questions. I want you to understand my perspective and where I'm coming from. And you go through that. And again, you put it in black and white and you label it truth number 2. And then you go on if there's a truth number 3. So then once you've documented both truths, here comes the hard part. You've got to start. It's a starting point to work on solving these solutions together. So this next approach can help you to do this. This goes a little bit more deeply. This approach is called positive intelligent, and it's my go-to method. It's what I use as a coach. It's what I use in my life to solve life's challenges. And as a matter of fact, in a future webinar, we're going to go into this in a lot more detail. But for today, the only thing you have to know is that this approach helps us avoid getting triggered by our emotions. Okay, so knowing this, can you take a moment to think about the conflict that perhaps you're going through with your family? And I want you to go through the next 5 steps with me. So the steps are going to be, we're going to explore, we're going to navigate, we're going to go back to empathy again, and then we're going to innovate, and we're going to take action. So this is just a little guide, and I hope some of these tips can help you, but we're going to start out by exploring. And exploring means leave your emotions at the door. Replace them with deep curiosity. Pause, take a deep breath, and start with yourself and ask, what's my bigger why? What's my position, and why is this so important to me? What are my underlying needs and concerns? And you really need to be very honest with yourself to really understand how important this is to you. Secondly, you're going to navigate. And this is about getting perspective. It's like a compass. What's really important here? So it helps sometimes to ask your wiser elder self. And how do we do this? So imagine going sometime in the future and looking back on this situation and asking yourself, what would be really important here? What do I need to pay attention to? And what is truly not important in this situation? So going through these or asking yourself these questions helps you to choose your battles. If what you're battling or conflicting over is not important in the big scheme of things, move on, save your energy for what is important. So now step number 3, and empathy shows up everywhere in conflict resolution. Conflict is worsened when we're triggered. Our families trigger us. Difficult people trigger us. So knowing this, get back to empathy. Is there something you can appreciate about the person you're arguing with? Contemplate their position the same way I had you think about yours. What would be their bigger why? What would their concerns be? You can use language like, I can imagine you may feel such and such. Am I correct? Help me to understand where you're coming from. Now, this can be a challenge. You know, when siblings or others don't like each other and never got along, it's sometimes in blended families. But I want you to think about this. We tend to think others are the difficult ones, and they may well be. But once again, I'm going to ask you to look at yourself and ask, how might your own behaviors be contributing to this conflict? Is there something there that I need to look at myself? And if you can, and you recognize maybe you haven't been behaving as you wish, show yourself some empathy, some self-empathy, and forgive yourself. And just be more aware of it and move forward. And then finally, innovate. So this is where you get your people together, but you have to have an agreement. So this is a time when you have to at least have arrived at a calmer place. Create a safe space to share all your ideas amongst yourselves. But you have to accept to listen to everybody's opinion without interrupting, even if you don't agree. And it helps sometimes, some of you may know this, but use a talking object. This is a paperweight, or you use a stick, and only the person holding the object is allowed to speak at that time. The other thing to keep in mind is, even if you think somebody else is out to lunch and they have the most preposterous idea, generally you can find a little morsel, a 10% to focus on the value of their 10%. Then together, summarize all the best points that you all came up with. And then finally, it's time to act, make a decision. So establish some steps to resolve the conflict. What do we need to do next? What's one small step we can take together? And then another, and build on it. So just even if it's one small step, acknowledge those small successes. So this, some of you might be just shaking your head and rolling your eyes and say, there's no way this is going to work in my situation. So what do we do when nothing works? Well, it may not be realistic to try to change patterns and situations that have been present for years. Or it may just not yet be the right time. But if you cannot manage to get along well enough, you may have to activate in a different way. That may mean you have to step away, set limits, say no in the way that you need to for your own self-preservation. This is where legal guidelines are extremely helpful. Start there. Abide by the laws, the rules. Follow the legalities, the wishes of the person legally responsible. Comfort yourself with the fact that you tried your best. Self-preservation. Leave the door open, though, if you can. It may not be the time yet, but perhaps sometime in the future. Back to you, Lucy.
Thank you so much for that, Joanne. I know this is your expertise, and just listening to you certainly gave me a lot of food for thought. But we keep telling caregivers, you don't have to do this alone, okay? I mean, this is really important. When your best efforts fail, there is help out there. So the same way that you're here listening to our discussion today, there are social workers, there's family counselors, there's individual counseling or family counseling, mediators can help. Caregiving can be turned into an opportunity to strengthen family bonds through the challenges of dementia brings, So I think it's really important. And there's so many things that you spoke about, Joanne. So I think let's have a caring conversation. And I truly hope that all that are participating today with us will share what you're going through and have the opportunity for us to really, really talk about it. So I welcome you. There's the chat. There is, you can lift your hand up, whatever means.
I think we'd love to hear what kind of conflicts you're going through. And if anything resonated with you, these are tough topics to share. This is tough to share. Is anybody willing or feel ready to tackle this topic?
Well, do you hear me?
Yes, we hear you.
Okay. I'm going to tell you that I am in a situation where I have prepared my all the legal documents, and I realized that finally the person that was supposed to be dealing with this is finding that it's too much for him, that he is too far, and it's very difficult for me because of the situation in which I am to try to search for somebody else in the family. I have only one sister and brothers that are within the family, but I don't believe that. Not only I don't believe, but I discarded them as being able, either by age or training, to be able to do these kind of things. So I am at the point where I'm just wondering. I know that my mother lived another 10 years. I'm just at the point where I'm wondering if I should not go with the government and ask and sign for somebody to take care of my future. And I am quite afraid of this because I do understand the system and I do know it.
Thank you for sharing. And that's a struggle. And sometimes we see that where things change. People were designated these roles years ago and they grew older or they're far away. Are you asking for yourself or are you one of the caregivers?
No, I'm asking for myself.
Okay. So, and just for some who might not be as familiar, if you really can't find a representative and there's no family member able to do it, there are two choices, privately or publicly. So you can try to find somebody, if the finances allow it, to hire somebody. Often people hire accountants or lawyers or notaries. The other way, there is the public system that you referred to, which is the public curator's office. So, although maybe Lucy, you will have something to add, but it's a tough decision there. The public curator, they have their role. They do take on the responsibility and will look after your wishes if you very clearly mandate in a living will and in your mandate of incapacity what are your wishes. Then they will. There is a process that you can. You need a notary and a social worker, and you can go ahead and they will assign someone to represent you. Does that answer your question?
Well, it's a step forward. Thank you very much.
Thank you. Lucy, did you have anything to add to that?
No, I think you were very clear about that. So if this lady has financial means that she would like to choose someone, as you said, but the other way is to be very, very specific with the public curator, what it is that you want and what you need.
So I see there's all kinds of things in the chat. I don't know if Diana.
Absolutely. Yeah, sorry. There's 3 people who've made comments in the chat. So I'll start with the first comment. My sister always makes me feel like I do too much. So how would you address that issue of setting limits?
Yeah. Lucy, I just want to say something first. I'm going to pass this one over to you, but thank you for mentioning that, because when we talk about caregiver burden, it's interesting. We always think, well, the person who does the most is the one who's suffering and feeling the burden. But sometimes something interesting to think of is sometimes because of our tendencies, our personalities, some people take on the caregiver roles. The other person sometimes can also feel like maybe they'd like to play a greater role. What can also be at play is that person may be worried for you, or maybe very concerned for your well-being, or they may be feeling a little bit guilty themselves. Maybe they can't come through as you do. So I'm going to pass it over to our Lucy Barylak, our caregiving expert, for some additional info.
No, this is a very familiar question that many times setting limits is very hard. You know, a lot of caregivers, including myself when I was a caregiver, felt that I was the only one that could actually take care of my mother the right way. Okay, I knew how to make her feel comfortable in the bed. And that's something we have to recognize, that it's okay. We should be able to, other people can do it, maybe not as well as we can, but they're not going to harm your loved one. So setting limit with yourself as well. And it's interesting what you said about the sister. Maybe she's feeling a little guilty, sharing and allowing maybe your sister to be a little bit more involved. I think that Claire had her hand up.
Yeah, I thought I would just jump in this one, because I think working with a lot of families, oftentimes a family member will call me and say, my sister looks like she's burning out, or my mother looks like she's burning out. And the problem when we get into what I call that cyclone of caregiving, right? It's that moment that once you get in there, it's very easy to no longer set boundaries for ourselves, right? We don't give ourselves permission to even take a break, have a day off from going and visiting mom or dad at the residence, or just having a walk for ourselves. And this guilt, like you mentioned, it becomes so all-consuming that we just lose track of ourselves, and it often takes a crisis to occur before something changes, right? And I think from the very beginning, it's really important to set boundaries and give yourself permission to have some time, because like you, Lucy, when I was a caregiver, I suffered a severe burnout, and it was all just because of a lack of reaching out for support and feeling that I had to do it all. So it's if you don't take care of yourself, who's going to take care of your loved one?
There is a reality there. Like, I knew what my mother liked to eat, or how she liked to have the food put on the plate. But these are things, setting limits is very, very important, because you need to give yourself the time to take care of yourself as well. I see some other questions.
Yes. So the next question is about coping mechanisms. So my adult children are anticipating grief, and they're drinking instead of helping.
Ooh. So it would be interesting to know who is the caregiver, and is it the person that's asking the question? Are you the caregiver, or are they concerned about you? Was it clear to you, Joanne?
No, I'm looking to see if they maybe.
Yeah, they may not answer.
Yeah.
But I think my adult kids, let's assume the person is the caregiver, Lucy.
Well, if the person is the caregiver to the partner or the spouse, and the kids are really concerned and are starting to drink, I mean, I'm just wondering if this is a new habit, or this is something that was before. What's the situation going on? I don't know if he or she has confronted the kids. I think all the steps that you were talking about, to sit down, to be honest, to talk to each other in a safe place without judgment. If she can ask her children, her adult children, how do they feel? What's going on? And as I said, not to be judgmental, and to really look at the situation, to possibly come up with, so it's very hard to elaborate on this, because I don't know what the history is of these adult children. What was it? Did they drink before? Is it something new? What are their fears? To be able to allow them to talk about the fears, and to really feel that they're united as a family, and what can they do about it together, and not just look at it as an individual situation.
I like the questions you're asking, Lucy, and maybe the writer can come back and give us a little information. What's striking out at me, though, if they are drinking, And again, we don't know if this is part of their regular habits, but if they're self-medicating, it's just a big indication of pain. And, we're talking about conflict, and most conflicts don't come from malice. It comes from anxiety and emotions and worry over the caring. So this is a big sign of and we have a lot of anticipatory grief with dementia. We're losing that person bit by bit before they're even gone. So to me, this is in this situation, it would be great to have somebody come and get involved. If you've already tried some of the strategies that we presented today, like being straight, being direct, and saying to your adult children, this is what I see. I see you in pain. I see you drinking. And really what I really need is your help. So maybe if you could just be honest with me, can you be there for me? And if you can't be there for me, let me understand a little bit more. Can we do this a little differently? So it boils a lot down to communication, whether you can do it with your children or bring an outside counselor in to help.
Great. Thank you. Thank you, Joanne and Lucy. That's really good advice. So the next comment, dealing with denial is difficult. By the time people realize there's a problem and they accept it, the person who saw the situation from the beginning is very tired and has less energy. How would you respond to that?
I agree. Denial is huge. It's very hard to accept. And I think many times it's really hard to accept for adult children that one of their parents is not functioning the way they were before, that they're not the same person anymore. And even though, the caregiver recognized it way before, it's difficult. It's a very, very difficult thing to accept. And I think that the most important thing is the whole idea of acceptance is not an easy process. And many times, some people really need to have the opportunity to be able to speak to somebody about it and to be able to look at what's going on, to have a better understanding also about the disease factor. Also, what is dementia? There's so many different aspects of dementia. What is it exactly that's happening? And I could tell you on a personal level, I had a hard time accepting. I was in denial for a long time until I was able to kind of recognize, and even though I was in the field myself. So it's not a matter of being, it's explaining. And if the caregiver could show a little, to talk about it and to give the adult children or family members the opportunity to really understand what's going on. One of the things also is many times in denial, people remember from the past. Oh, look, they know what happened about, maybe 50 years ago. But this is part of the disease. It's educating yourself. It's being able to understand the process and what happens when someone with any form of dementia is going through the steps that go through. So denial is big. It's there. And it takes time and a lot of energy. And it's scary. It's really, really scary. So as you said, Joanne, before, to be able to tell your adult children or family members, I understand that you're scared. My kids were scared too, to see their grandmother the way she was. So we talked about it.
I just want to add, I'm a caregiver also. Lucy knows this and I'm a part of 3 siblings. And, one thing I want to say about denial is sometimes we use it to protect ourselves. Sometimes we really need that layer. And I know with my brother, my sister, and I, we sometimes get things at different times. We just don't always get it at the same time. And if I could offer something to minimize conflict for the person who really did see it from the beginning and is exhausted from trying to enlighten their fellow caregivers, I would say to minimize conflict, avoid, because there might be a tendency to want to say, oh my God, I told you so, you finally see it. But try to avoid that, because one thing, if we want to get along with our fellow caregivers, we do have to kind of, again, go back to empathy, respect where they are. And I guess the important thing that I want to emphasize is it's less important to be right, and it's more important to preserve your team together. So I empathize that they're exhausted. They were able to really see it sooner, but
can I jump in also, because we talked about this just before we began. A lot of the cases that I see, for example, are, so when a parent is diagnosed with dementia and then they have a few siblings and they have the assessment, it's very important that things be done to either introduce home care support or transition. But either a sibling or it could be a parent is in complete denial, where they absolutely refuse to go ahead and make any changes. And this is, we're not talking at the beginning of the illness. This could be at the middle of the illness, where the conflict arises because the person living with dementia is now in an unsafe situation, but the family is not on the same page, causes a lot of conflict. So what can be done? I mean, if we're talking about, this could impact the safety of the person, and if the family cannot come to an agreement about what should happen, I mean, as social workers, what is the legal recourse? What can people do? Because it can get very serious, right? If the person living dementia is still living alone at home, one sibling says we need to get help, but the other sibling says no, they're still fine. There's nothing wrong with them. You just want their money. There's all kinds of situations like this that cause conflict. So what is a recourse for families?
We have to always look at the risk, so that, because there are different, you can be in denial that somebody is forgetting somebody's name, but that doesn't really pose a risk. If you're in denial that somebody is leaving pots on the stove that are going to boil over in an apartment building that could cause fire to others, or if somebody is at risk to wander out the door, then there is recourse, and it's all based on the risk. And in those cases, then sometimes we have to call in social workers to force interventions, but it has to be based on risk. So we get the person reassessed for dangerosity. And then it becomes in the hands of a physician, or sometimes we have to get lawyers involved when family members don't agree. Does that answer your question, Claire?
I mean, sometimes if the family doesn't agree, for the safety of the person, you have to get probably the public healthcare system involved, or sometimes I guess it even goes to a court-appointed lawyer if necessary.
Yeah. I mean, this is when we see forced placements, but really, usually, I'm happy to say, at least in my experience, we often thought we would get to that point, but usually with a lot of work, we avoid it. But even in hospitals, this happens. Sometimes you'll see people end up in hospital and the family members don't agree. And sometimes the hospital will override if they see a situation where the person is at risk of imminent danger if they go home, or imminent danger to others. They do have a right also to consult ethicists and physicians. And the reason I'm bringing that up is it's not just hard for us as family members. Sometimes it's hard for professionals as well to make decisions, because you have to weigh risk. You want to weigh how bad is the risk, and how, and what do they deserve to live the way they want to live. I see there's a lot more questions in the chat, so I thought maybe we should go on to some of those.
Yes, absolutely. So here's the next question. Thank you for the tools. I wonder if you might suggest or explain how the 2 truths or positive intelligence exercises may be adjusted and applied when addressing conflict with professional caregivers, perhaps a home health service or a long-term care home staff member.
You know what? I think these like I said, I use it in my personal life for everything. These are strategies. So I think that's very interesting. I never thought about using this with professionals, but you probably could use these strategies with professionals as well. you'd have to ask them, you'd have to really start by seeing if they're willing to do this with you. And you're giving me food for thought so that when we do a session in the future on positive intelligence, I hear what you're saying, and maybe we'll have to include dealing or this is a great topic, how to deal with professional caregivers when you don't agree. The only other thing I want to offer is the same answer as I gave previously. It really does boil down to risk. Often we have clients who maybe live in situations that we're not comfortable with. We don't love them. Maybe there are some small safety issues, or they're just not living with the dignity that we would like them to live with. But unless there's real risk, sometimes we can't make a move. Sometimes if people are still competent, and even the caregivers, we have to wait. When caregivers disagree, again, it's a lot of communication and a lot of weighing the risks.
I just want to go back to something that's very interesting what you're bringing up, because I think that a lot of caregivers sometimes do have issues within with professionals or with healthcare workers in the field. Everyone is very stressed out, a lot of work. The whole idea behind it is that as a caregiver, you are an advocate. You are an advocate for the person that you're caring for. And it's difficult sometimes when you feel ignored. You need to know your rights. There's always an ombudsman in every institution. You can make a complaint, not to be afraid to complain that if you do, what's going to happen to my mom or my dad? That's a big role that we take on. It's not an easy role, but because of our healthcare system, or even in the private system, that's part of what a caregiver does, that advocacy piece. And I think the tools that it was really food for thought, Joanne. It's something to include, because I think many caregivers go through that maybe they don't agree with the social worker, or they don't feel the social worker is listening to them, or if it's in a long-term setting, they're not getting the help that they need. You feel, anyways. But thank you for that.
Great, thank you. So we have another comment and question. It's a little bit long, so bear with me. Very interesting. I'm a community coordinator, and I find it hard to connect with a caregiver, especially in rural areas. Often I see situations that need support for the senior living with dementia and the caregiver, such as respite, housekeeping, being left alone, etc. The aging at home strategy is only effective if community support is available. So what are your thoughts on access to services in English and in the North? And how can we support people in need if the service is not accessible? Can clients living in the North reach out to you? Often the Alzheimer's Society of Montreal refers to local offices in the North, but the service is not provided in English, and the client is referred elsewhere, playing ping pong. Burnout is high and isolation sets in. I have a lot of community members in need of day programs, etc. How can I support them, and how can I have them access support?
Wow, that's a big question. Lucy, do you want to add, or do you want me to take this one?
You can start. I'll follow.
Because it's interesting. When I was in the public system, we worked with a lot of clients coming from the North. And you're not talking about Montreal North, you're talking about north of Quebec, right? The outlying rural regions. So there, I have to be honest, I'm less familiar. I feel like this could be a whole webinar on services for the north of Quebec, and I'm not sure where all our listeners are from. But so there's so many questions in here. I just want to start with the top one where you're asking, it's hard to connect with the caregiver. So you're a professional looking to connect with the person's caregiver to provide services. Is this what I understand? So I hope I'm understanding correctly, but I think also we do want to say that, we're just talking about having challenges with professionals, but sometimes professionals do have challenges getting in touch with caregivers or having caregivers be present enough as well. So that is another aspect. The only way I can answer your question, if I'm understanding it correctly, is letting that person know. And again, if there are risk factors or the person is not being adequately taken care of, then professionals they question, is this the right person to be the caregiver? The question about lack of services in English goes back to what Lucy mentioned about ombudsman, about lodging, advocating for English rights. This theme seems to come up lately in all our webinars. But there is information about accessing services in the North. And I suggest I'm assuming you're from Quebec. I hope I'm not misassuming. So you really start with your CLSC, and there are certain CLSCs who have the mandate to respond to people in the North. I can't comment on the services in English. We hope that, and you deserve services in the language you speak. If you don't get an English worker, there are translators also, because when I think we have to service people in every language, and we access translators.
Just to clarify, the question was asked by a person who was from the Laurentians.
Oh, that's very funny. So in the Laurentians, so your question is, you know what? Everyone's entitled to services in their language. I would access your CLSC and see how they can help you to access an English worker. And then you have to go to your ombudsman. There are cases, I don't know if you can still do this today, but I know because I worked in a designated English service CLSC, we did accept a few clients from other territories because they needed English-speaking workers. But I can't tell you if that's the case today. You really have to start with your worker and request the services.
Thank you. So there's no new questions. There was a comment about whether, just pertaining to an earlier discussion, if a family friend could help out. So
definitely.
I think.
Yeah. You can, as long as someone agrees, you can ask anyone to represent you. So you should give thought to, because the question was very interesting. You should give thought, how old is this person? They should be quite a bit younger than you, because you want them to be able, to be around to make decisions for you. So anybody that agrees, it doesn't have to be a relative. It can be a neighbor, could be anybody, but they need to be willing to do it, and they should be motivated to do it. So you don't find yourself in a situation where someone said yes to be nice, or because they couldn't say no to you, and then you have an unwilling representative.
Could I give an example also of another type of conflict that really wasn't mentioned today, but it's something that I had experienced personally, that I know some of the people that I work with. So my mom was in her early 70s when she had been diagnosed, and she had a close friend of hers who at the beginning started accusing me of falsely wanting to place my mother, or falsely claiming that my mother had dementia. And this woman, kept calling and calling, and it became very toxic for me. It became very upsetful, very hurtful for me, because I recently had another case of somebody going through the same thing. And I think that, when we talked earlier about setting boundaries, I think that it's important that this could be a person who's causing conflict in your life that may not necessarily also be an immediate family member. It could be a friend of the family. And I remember, in order to deal with this woman, and it was very difficult because she was a very close friend of my mother's. When my mother was placed, she would even come and visit, but every time she would visit, she just started accusing me and calling me, and I had to really cut her out of my mother's life, actually. And it was hard, but so I think I just wanted to say that, conflict could happen. It could be also like friends of the family, extensions of the family as well. I thought I would just mention that.
Yeah, as you're talking, I'm sorry that you went through that. As you're talking about that, what came up is one of the things that Joanne was talking about, the whole idea of having empathy. This person must have really been very close to your mom and cared a lot and was probably upset and maybe, fearful for her own self and what was down the road. So, it's difficult. That's for sure.
We do have a couple more questions that just came in. So one of the questions is if you can speak about how to take turns with caregiving if the siblings don't get along.
Mm-hmm.
Suggestions?
You mean how to take turns if the siblings don't get along?
How to take turns, yes.
How to take turns. I mean, they first and foremost, they have to be willing to do that. So you have to have a good understanding of whether they are interested in doing that or not. And I think going back to what Joanne was saying, I think it's so important to have a family conference and to take a look at and have a really good understanding what people can and cannot do. Mm-hmm. And because you might think, well, listen, she doesn't work or whatever, or she doesn't have children at home, but there might be other reasons why. So I think it's listening. First of all, listening. If the person says, I can only give you 1 hour a week, for example, ask them, okay, that's fine. Understand why they can. And even if you don't understand, it's okay. The whole idea behind conflict resolution is to not escalate the situation. Many times we just have to step back and accept and just see where it goes. One step at a time, as Joanne was saying, dealing with one thing at a time, being respectful, acknowledging, and putting a plan together.
I would add, Lucy, thank you for that. And I would add just one more thing, just about the language taking turns. Sometimes there are also other ways, and I just want to share personally, my brother, my sister, and I, we can't always do the same thing, and it can't always be even Steven. So something else maybe that we can offer you is to think of what can each one do. It might be different. Maybe somebody does, the visiting. Maybe somebody else goes to the doctor's appointments. Maybe somebody else does the shopping. So sometimes just looking at yourself, and Lucy, it's very important what Lucy said about accepting. You really don't have a choice. If one of the siblings doesn't want to visit or doesn't do something, what are you going to do with that? So maybe propose, okay, I really get you can't do this. Is there anything you can do, or what would you feel comfortable doing?
Thank you. So I'm going to just read another comment that this relates to the earlier discussion about the adult children who were drinking and how can the person help their adult children. So just to give a bit more context, I'm from San Diego, California. Community and hospice support has been very good. I'm just very concerned about my adult children's mental state. I need their help, but I'm afraid that they may be having a breakdown and I don't know how to help them.
Lucy, would you like to take on that one?
Yeah, sure. Look, I think just the fact that you're recognizing that something is happening with your children, it goes back again to having communication. And historically, is something that the family has been able to do, to sit down. I think it's so important for you to invite them. You know them better, maybe on an individual basis, maybe together. I think you have to acknowledge it and recognize and let them know that you're worried about them, that you're very concerned about them, and giving them the opportunity to maybe express themselves and see where that goes. It is very important to, and again, with no judgment, it's just, I care, I love you, I see that you're hurting, how can I help you? And start from that point on and see where it goes. I mean, having that open way of communicating is so very important. Do not ignore it. And as we said before, do not deny it, and I see that you're not. And it is very worrisome, especially when you're a caregiver, you're caring for someone, you need the help of your adult children, and you see that they're in turmoil. Well, maybe at this particular point, they cannot help you. Maybe they need help themselves. But by you acknowledging and recognizing that you care for them and you're not judging and you're there to help them as well. Not an easy process to go through, but it's one step at a time, as Joanne said.
Thank you. Do we have any more questions, Diane? Because I think we're...
No, not really. Someone was asking about resources. So I would just remind people to go to the website, mcgill.ca/dementia. We have a section there with trusted resources, which is very helpful, as well as all the other resources that were mentioned previously. And there's also our email address. So I'll put our email address in the chat as well in case anyone wants to reach out directly.
Mm-hmm. Well, I'd like to take this opportunity to thank Joanne and Lucy for all of this really great advice. I feel like we could probably have talked for another hour, and talking about positive intelligence, that's going to be the next topic. Next month, Joanne and Lucy will lead a discussion to introduce the positive intelligence approach to caregiving, offer some tools for an approach that favors resilience and moving forward, and discuss finding the gift or opportunity behind difficult circumstances. This will be on February 16th at 11 a.m. Please look for the registration link on our website, or for those of you that are registered for our mailing list, you will be receiving a notice about this upcoming webcast. But once again, I would like to thank the Petro-Canada Caremakers Foundation for supporting today's webinar. And you will be receiving a short evaluation form by email. Please fill it out as soon as possible so that we could see what works. If you have some suggestions also with regards to topics that you would like us to cover, we would really love to hear from you. And once again, Caring Conversations is an initiative of the McGill University Dementia Education Program, which is funded by private donations. If you would like to make a donation to our program, we welcome you to go to our website. And if you would like to join our mailing list, please go to dementia@mcgill.ca. Thank you very much for participating. And if you'd like to continue the conversation, again, you could send an email at dementia@mcgill.ca. We will forward your questions to Lucy or Joanne, and they would be very happy to get back to you. So thank you.